want to make sure that the community realizes that we're a resource, that the emergency department, both here and at Plainfield, are resources for them, so that they always know that it's a safe place to come to. On a personal note, when this was enacted, my wife, who was a PA at Hartford Hospital, or Connecticut Children's at that time, was one of the first people to have somebody come in and give them a baby, and gave it straight to my wife. And it was just an incredible thing that somebody could feel that they're safe and they're not going to be criticized or looked down upon when they do something like this. It's an incredible act of safety and looking out for the best thing for their child, is to be able to bring them somewhere and give them up for somebody else to care for when they feel that they are not safe to care for them.
On behalf of Backus Hospital staff of 1,800 members and medical staff and our community, I want to welcome our legislators here today for one of the great initiatives, public safety initiative, children, infant safety initiative, social initiative, healthcare initiative that really is meaningful, that our legislators are leading, Kathy's leading on behalf of us, and we are just proud to be a great partner.
So originally, the Safe Havens law passed in 2000. It was designed to protect babies from being abandoned. What that did was to provide people a way to drop a baby off and keep the babies safe, and the parents and the mom from being vilified for dropping the baby off. This is a humanitarian way to protect babies. Last year we passed Safe Havens Day, which is April 4th of every year. We want to have an event like this to get information out to women of childbearing age that there is a safe havens for them to drop a baby off should they determine that they can't take care of that baby. As a result of that law and the continuing conversation that we've had, in the last actually 4 months, 3 babies have been dropped off at emergency rooms, 2 in January and 1 in February. We consider that an absolute win and something that is meeting the needs of the legislation and meeting the needs of your patients, our constituents. Many people had asked in the past, why not drop a baby off at a fire department? Well, we want the babies to be dropped off someplace that can gather medical information that's necessary and is a safe place for babies to be taken care of. There is no better place than our local community hospitals.
As nurses, our job is to be the patient advocate, and we prepare for the high-risk, low-volume incidences on a regular basis. This is one of those times. The emergency department here at Backus Hospital and the East Region of Hartford Healthcare, as well as Hartford Healthcare as a system, is prepared to take any patient that arrives at our front doors. This includes our most vulnerable population and patients that may be part of the Safe Haven Act. With our partnerships within the hospital and our community partnerships with Department of Children and Family Services, fire departments and police departments, we can assure you that if you need to utilize this service, your child will be taken great care of. We'll make sure they get everything they need.
And so having the emergency department and our great emergency team be that beacon of care and safety, it makes me proud. And I just want to make sure that the community continues to understand that we are a resource for them, and that the Safe Haven Act is something that's so beneficial for our community.